Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Welcome back to another episode of Dental Fuel. Dental Fuel is brought to you by 90 Day Jumpstart, a program to help you increase production and break free from financial stress. There are so many things in a dental practice that can be scary. Jeff Horowitz talks about overcoming fear and embracing growth in the dental practice. Jeff talks a little bit more about specializing in sleep and TMJ disorders, and also talks about some key insight that he'd like to share to fellow listeners. Let's tune in.
You have shared some excellent advice with us today, but I would love if you would share one key advice that either you have received or one key advice that you would like to leave with our listeners just to kind of sit on and think about as they move forward in their practice.
Don't be afraid of The Dip, which is another great book. The author's name is actually escaping me right now. It's called The Dip. And a lot of dentists practice with fear. They may be passionate about something, but they don't feel like they know enough. Or they've learned a new technique, but they're just not confident enough. Or they want to offer this type of service, but they don't feel like they have enough of the right team members to pull it off. And so dentists will not do things because of fear of that dip, that when you put your feet in and when you start doing anything, there's always going to be this period where there's going to be the learning curve. And you might see a drop in production. You might see a drop in productivity. You might see frustration. You might see, other unforeseen financial problems. But again, and I've used the word intentional many times, but I think in dentistry, we let fear dictate a lot of what we do and what we think we're supposed to be doing. Find your passion, get the education, find a good community or mentor, and then don't be afraid of that dip. It will happen. You are going to have struggles. I started a dedicated sleep and TMJ practice, and I could literally spend the next 2 hours talking with you about how that affected me financially. Luckily, I was in a place where I could do that and accept that dip for the little while, knowing that there would be a reward at the end of it. And sure enough, that's what's happened because I was intentional. I'm not just going to, jump out because of the dip. So, follow your passion and don't be afraid of the dip.
Fear is definitely very prevalent in our profession. And I think a lot of it, some of it may go back to, that first case that you shared, that fear of, I'd like to try something new, but what if I get sued? I think that can be really very challenging for someone to process and just to wrap your mind over something so large that could happen to you and to your practice. And I think that can be really a hard pill to swallow when that does happen. And for me, personally, just as a new dentist who's learning every day, learning new techniques, it can be hard to implement those new techniques that you learn at a CE course, because what if you're not ready? And that sense of comparison that you compare yourself to Joe Schmo on the internet who's posting all these beautiful cases, and that your hand skills just aren't there yet. I think that dentistry can be a really hard place sometimes.
It is, and I agree with that. But it's interesting. I do a lot of expert witness work here in South Carolina. Always on the side of the dentist, by the way, on the defense. And sometimes I have to say, you're going to be best to settle this case, and many times I will go to bat with everything I've got. But there's really a couple of reasons that people get sued, and we shouldn't practice for fear of being sued. Because it can happen regardless of how good you are, and it doesn't matter who you are, what your name is. There are two primary reasons that people get sued: bad intent or bad result. Anyone can have a bad result. Like that can just happen sometimes. And it does. And regardless of who you are or how well you're trained, there might be a settlement on that, and let it go. If your intentions were good, those are the doctors that typically the settlements are lower. Those are the cases that can always be argued. The settlements are lower, many times dismissed. It's if your intent is good and your follow through is good, the bad result thing, bad things happen to good people all the time, and we can't control that. Those things are out of our control. Just be good, whatever it is you decide to do, just do it with good intention, and don't let that lawsuit thing, weigh you down.
Do you have any advice for dentists who have maybe a little bit of lack of self-confidence in themselves, and maybe how they could get better with that?
That's really
I'm sure there's a book for it.
Yeah, there really is. But it's such an interesting question because patients sense confidence right away. And not just from the doctor, from the assistant as well, from the hygienist. When a patient gets in front of somebody clinical who's going to be touching any part of their body or having any impact on their health, there's this immediate need to be comforted by this person's expertise or care, right?
Yep.
And if we are easily allowing patients to feel that we're not confident in ourselves, then unfortunately, that can create a really tough situation. And the only way to gain more confidence is to do more of the procedures. And whether it be on a typodont or whether it be you work in a clinic, maybe there are many clinics for underserved populations where you can go and offer a great service to the community and get a lot better at many of these procedures. But that's where confidence comes from. It's getting the right education, but it's also just doing that procedure enough times that you've seen the outcomes, and that's the only place confidence can really come from.
Great advice, Jeff, and very well said. And it's always a joy and privilege for me to have the opportunity to speak with you. But before we wrap things up, I would like to talk a little bit about Dentists in the Know, how you got involved with Dinks, and what it is exactly.
So I appreciate you bringing that up. I didn't realize we were going to speak about that. But, Chad Duplantis and I, Dr. Chad Duplantis, we were both doing a lot of lecturing before COVID hit. And COVID then hit, and we're just like, what do we do with ourselves now? How do we get good information out there? And so my idea was to create just a weekly podcast or a webcast. It was, I said, let's start a Facebook group. Let's have a glass of wine. We're all shut-ins right now anyway. Let's have a glass of wine. Let's get really great information out there, honest, vetted information. And Chad's like, I'm in. And I was like, let's call it something in the know, Dentists in the Know. Chad's like, what about Dinks? I said, no, we can't call it Dinks. Dinks stands for double income, no kids. And Chad's like, you're friggin' old. Nobody is going to know what that is. He's like, what is that, an 80s reference? And I'm like, yeah, it's an 80s reference, but it's making a resurgence. But he's like, trust me, everyone we talk to, no one's going to know that. He's like, let's call it Dinks. I'm like, you know what? I'm going to go with it. So we did that. We started doing broadcasts. We enjoyed it. We started bringing on great people from the community like you to talk to and say, hey, what are you doing? How are you dealing with this? And it quickly became a quite a social community. I had a great friend, Dr. Jennifer Bell, who I had known through the AGD. We were both very active in that organization. She was vice president of North Carolina the year I was president of South Carolina. And honestly, there is nobody that understands what's going on legislatively, and no one that I would want fighting for me in dentistry more than Jennifer Bell. I said, listen, This is a talented, brilliant clinician who is very active in organized dentistry. We have got to bring her on and let her showcase what's going on in dental news, in the ADA and the AGD and all of organized dentistry. And I think it'll be a good chemistry because she's a lot of fun, and the chemistry was just automatic. And we grew to podcast and Facebook and Insta and all that fun stuff now. And something I never thought I would be involved in, but it goes back to what you said earlier. It's about the community and getting to know people like you and like David and just amazing people who just want to do good by the profession that's been so good to them.
The chemistry is just phenomenal between you three, and you, Jeff, JB, and Chet are just wonderful people. And you guys have a special place in my heart, and I'm so glad that we have had the opportunity to just get closer this last year or so, or these last few months. And I look forward to what the next few months bring. But Jeff, if our listeners would like to connect with you, what's the best way?
Probably simplest is my email, J, and then my last name, Horowitz, HOROWITZ, DMD@gmail.com.
And I highly encourage you all to connect with Jeff, but also connect with Dinks. If you haven't tuned into their conversations on Wednesday night, I highly encourage you to do so. It's an hour of camaraderie. You get the news. You get in the know. If there's something that's going on that you don't know that you need to do, I highly encourage you just to tune in, because you will be in the know and you'll find out what you need to know so you can go ahead and do it. And so they're just a lot of fun. And I also encourage you all to seek out Jeff at a local conference. I know that he speaks at some conferences. And so if you're interested in learning in any of the topics that Jeff brought up, especially sleep and airway, I would seek him out at your next conference. You may find him there speaking on that, and he has a lot of energy and a lot of knowledge to share.
That's so nice of you to say, and thank you for having me on. And it's always so great to get to hang out with you. And I as well, I've really enjoyed getting to know you, and it's been amazing getting to work with you. And wish you all the luck with this, because it's an amazing platform.
Well, I appreciate that, Jeff. Jeff, thank you so much for your time today. And to our listeners, we'll catch you all next time.
We hope you have enjoyed our conversation with Dr. Jeff Horowitz. Be sure to tune in to Dentists in the Know every Wednesday evening live on YouTube. You can also check them out on Instagram at Dentists in the Know. You can also find Jeff on Instagram at Dr. Jeff H. Be sure to follow us on Instagram at Ignite DDS and at Dental Fuel. Be sure to tune in next time, where we'll have another guest here at Dental Fuel. If you're looking to grow your practice and need some help along the way, be sure to check out 90 Day Jumpstart. You can start for free by contacting Dr. David Rice. Check out the link to his Calendly in the show notes.